mental health all about? Well, it's a program created to offer different types of therapies that help people feel better mentally and emotionally. We use science-backed methods that are proven to work and can be customized to fit each person's needs. We focus on three main things. Number one, cognitive behavioral therapy, CBT. This is one of the most effective ways to change negative thinking and behavioral patterns. Whether someone is dealing with anxiety, stress, or depression, CBT gives them practical tools to get back on track. Number two, psychological first aid, PFA. Sometimes life throws us a curveball, like crisis or traumatic event, and we need immediate support. CFA is like emotional first aid that help people get through those tough moments when they need it the most. Number three, other modalities. We know that one size doesn't fit all, so we offer other types of therapy, like mindfulness, which helps people focus on the present and reduce stress, acceptance and commitment therapy, ACT, which helps people face their thoughts and feelings without letting them take over, solution-focused therapy, where we help people find quick, practical solutions to their problems, traumatic-informed therapy, which provides a safe space for healing after trauma. One thing we are passionate about is getting out into the community and spread the word about mental health. We offer workshops, trainings, and events to help people understand mental health better and to break the stigma around it, whether it's teaching simple stress relief techniques or helping people spot early warning signs of mental health issues. We believe everyone can benefit from mental health education. At the initiative, we don't just look at mental health in isolation. We believe in taking care of the whole person, mind, body, and spirit. That's why we work with healthcare professionals, social workers, and even spiritual leaders to make sure people get the full support that they need. How you get involved? As we move forward, we want to invite you to be part of this journey. Whether you're looking for help, wanting to volunteer, or interested in learning more about mental health, there is a place for you at the Initiative for Cognitive Therapies in Mental Health. Thank you so much for being here today and learning about this important initiative. If you'd like to get involved, get support, or just learn more, please visit our website at www.cognitiveng.org or give us a call. We're excited to walk this journey of mental health with you. We appreciate your time and we look forward to hearing from you. You do have a pleasant day and God bless you. Hello.
Hello, and welcome to today's talking point. So today we'll have a dialogue on our topic today. It's called The Talking Drum of the Mind, Mental Health in the African Worldview or Perspective. We are honored to have to host this conversation across multiple platforms. So if you're on our Instagram, Facebook, YouTube, and X, you're welcome, and you can join any of those platforms and you'd find us currently talking. And we want to thank every one of you for joining us. Please join me in welcoming our distinguished guest speakers. First of all, I'd like to go with Dr. Mfon Bassi. Dr. Mfon, welcome to today's series or today's event. I'd like to give a little introduction about Dr. Bassi. Dr. Mfon is a distinguished environmental chemist with a PhD in environmental chemistry. She began her academic career with a degree in applied chemistry from the University of Calabar. Her passion for the academia led her to further her education, obtaining both her master's and doctoral degrees from the University of Uyo. Dr. Bassi has made substantial contribution to the academic community by publishing numerous research articles in prestigious journals such as the Asian Journal of Geological Research, among others. She's an active member of the Chemical Society of Nigeria and the American Chemical Society. I mean, with all this accolade, Dr. Mfon, if you were in our training yesterday, did a strong presentation on mental health and also the impact in parenting and how it impact parenting. She's also been a consistent speaker in our show. So I want to welcome you, ma'am. Thank you very much for coming.
Thank you for having me and welcome everyone to the show.
Okay.
Thank you so much for having me.
You're welcome. So our next guest speaker or our next guest, his name is Dr. Mohamed Gidado Ibrahim. Dr. Mohamed Gidado Ibrahim is a consultant psychiatrist at the Federal Neuropsychiatric Hospital in Kaduna. He is passionately dedicated to advancing public mental health. He's a graduate of Bayero University, Kano. He is a fellow of the Faculty of Psychiatry of the West African College of Physicians. Currently, he's pursuing a Master's of Public Health and holding a certificate in Global Mental Health from the University of Washington, USA. Throughout his remarkable career, Dr. Ibrahim is an advocate for mental health awareness and transformative policy reform, focusing intently on improving access to essential mental health services. With extensive experience as a frontline psychiatrist during public health crises like the COVID-19 pandemic, Dr. Ibrahim has provided invaluable humanitarian mental health support to individuals impacted by violence and natural disaster. His unwavering commitment to public health and mental health well-being is underscored by his involvement in critical initiatives, including the Technical Working Group of Alternatives to Incarcerated and the integration of prenatal mental health in Kaduna State. He's also a dedicated member of the Naltrexone study group addressing opioid dependence in the community. As a frequent guest on TV and radio program, Dr. Gidado uses his voice to elevate mental health discussions, inspiring awareness and understanding among diverse audience. Welcome, Dr. Gidado.
It's a pleasure having me.
Thank you so much. I'm not sure if we have Father Bature here yet. However, I would like to proceed to the questions. For the audience, I would encourage you to type your questions on all those platforms. We have people there who would send your questions to us. And after deliberating on all the questions that the audience, that the speakers would be deliberating on, we will create time for questions and we'll try and accommodate as much question as we can. So my first question right now would be to Dr. Mfon. And the question is dive into cultural perspective and community roles. Dr. Mfon, how do various Nigerian cultures interpret mental health, and what traditional practices are commonly used to address mental health issues?
Okay, thank you so much. We'll just take a general view. First of all, in the African culture, it is generally accepted, or is generally viewed. Mental health is generally viewed as a holistic perspective. That is, it involves the social, it involves the physical, it involves the environmental, it involves the community, and it involves ancestral relationship. You know, ideally, from the Western world views mental health as is viewed as a medical condition, medical issue. But the African view is quite different. And when we talk about the cultural view, it varies from one culture to the other. But if you look at it, all the cultures are pointing towards something, and that is the cultural perspective. For instance, if we go to the maybe the west Nigerian western side, which is the Yoruba culture, you find out that the way they view mental illness is that it is spiritual imbalance. You know, they talk about the Shango, they talk about their gods, they talk about their deities. So when someone has a mental illness, they attribute it to having violated something or committed a taboo against the spirits, as it were. You know, it also, in the Igbo culture, on the contrary, they look at mental health as a disruption of the person. That is, the person is cursed, the person has committed something, or the person has committed an ancestral offense. So, in that respect, they feel that once somebody has a mental health, there's something you have committed. You understand? They don't view it as a medical condition. Okay, let's look at the way the Hausas look at it. The Hausas, the Fulanis, they present the mental illness as being a spiritual possession. They think, oh, that when somebody has a mental illness, the person becomes possessed. It cuts across the African culture. It's not just Nigeria. Because if you go to places like Ethiopia, Zimbabwe, Ghana, they also have this kind of views that mental health are attributed to cultural beliefs. Either someone has offended the gods, either somebody is not doing what the person is supposed to do, either the person is possessed by one spirit or the other. And because of their beliefs on the cause, it also informs the way they handle the treatment, or they give treatment or remediations to this mental health. For instance, they believe in maybe ritual cleansing. Sometimes we see them in the movies, even our Nigerian movies, and we think, oh, this is just a movie. It is not just a movie. It is what is happening in reality. You see them take people to the river, so they prefer to do ritual cleansing. And of course, they will do sacrifices. They want something to appease the gods that they believe the person who is mentally healed has offended. So you see these practices, and then you see herbal remediations, especially like in the Yoruba culture. I'm not saying those herbal medications are not valid in some aspect, but when it comes to mental health, you understand, because first of all, look at it, the herbal medications, what quantity are they taking? So they resort to they resort to herbal treatment. And then they also believe in what we call exorcism. They want to cast out, if a community believes that it is by possession, that the person who is mentally healed is possessed, then what happens? An evil spirit or a demon has possessed the person. So now they will bring a priest, or they will bring a babalawo, or they will bring even a religious leader who believes that it cuts even into the religious sect, that a person who is mentally ill is possessed. And in that case, they will have to do cleansing, they will have to cast out the spirit, they will have to do deliverance, they will have to do a lot of things. So we find out that the remedies or the treatment or what they will do to ameliorate the situation springs from what the culture believes is the cause of these mental illnesses. So, like I said earlier, it cuts across all African, it's just that the names may be different, but all the African cultures, there's one belief or the other about the mental health, and that also informs their various treatments, ranging from ritual, exorcism, ranging from maybe casting out, appeasing the gods, making sacrifices to appease the gods, or community coming to do a sacrifice to cleanse the community, because they also believe that when somebody is ill, mentally ill, it is not just about that particular person, that the whole community has become infected. The whole community is going to be stigmatized because one person has become ill. So you see, in the long run, they don't look at it as an individual challenge. They look at it as a community challenge. So they have a wide overview of what mental illness is. So that is how the African culture interprets mental illness. They think it is a spiritual thing. They think it is a community thing. They think it is not a medical condition. That's the underlining factor, that it is not a medical condition and should not be considered as such. Thank you so much.
Wow, wow, wow. Thank you very much for engaging so thoughtfully with the question. I believe your insight are both enlightening and inspiring to me in person, and I hope as well to the audience. My next question goes to Dr. Gidado. In your opinion or expertise, how do communal and family structures in African society provide support for individuals experiencing mental distress or illness?
Okay, thank you very much, Dr. Ikolo. Good evening, listeners from everywhere around the world. So first, this is a very key or very important topic. And I want to start by maybe leaning or expanding on what Dr. Basi had mentioned earlier. We've to know the kind of support. We need to know why in the first place do people even have to offer this support. Of course, studies have shown the social support network that people with caregivers or family members offer to people with mental illness, it's quite higher compared to the Western world. I think the international pilot study on schizophrenia actually illustrated why people with schizophrenia in the developing world tend to do better than in the Western world. But to appreciate why, it's good to identify which some factors that are very important. As was mentioned earlier, one of the things that we see the support wife communal and family members of our support is the understanding of mental illness, as it was mentioned earlier. Generally in the African setting, mental illness is not seen as the product of just maybe disturbance in biology or physiology, but rather actually a product of a lot of things, but chiefly or mainly it has to do with uh, social issues, spiritual, moral failure, and so on and so forth. Now, because the worldview, the African worldview of mental illness has to do with socially, so it's in some part of the uh, community, it's seen as a maybe social failure. That means one of the way to support that will be to offer some form of social support. The next thing is even this the concept of communal identity and individualism. This is one of the factors that explain why people in Africa tend to provide social support to people with mental illness, and that's in the Western world. Mental illness is more of an individual, uh, maybe say problem or focus. While in our own searching, people tend to see mental illness more of a communal problem, meaning people perceived somebody, a family member having mental challenge as something that all the family are part of. So to really address that, that will require the family coming together to offer some form of support. So this is kind of a justification for what we see as the support people with mental illness get. The third factor I also consider to be the reason why we see increase in this is because the resilience and the reasons in our community, and one of it is on average typical African tend to be very passionate about whatever fit they possess, be it Christianity, Islam, or even traditional belief. People tend to hold on to some of these beliefs very dearly. And interestingly, almost all of these beliefs encourage support for loved ones, family members, with the hope that you get a reward in life hereafter. So this actually, among other factors, ensures or promotes with presence of social support among people with mental illness. Now, how are these support offered? In clinical setting and from my own experience, they come in different forms. One of it is financial. And usually when people think about support, they actually tend to think the financial. And of course, it's very important. Looking at most people look, cost of care. First, mental health is very expensive. There is little investment in mental as a whole. So the cost of care is largely out of pocket. So family members tends to rally around to support people with mental illness. So that's one of the financial support. And this could be looking at transportation from wherever they are, because access uh, is a challenge. And this the form of support could either be accessing care from traditional healers, faith healers, or even the orthodox care. So mostly the well-to-do family member actually tend to provide some financial support, which is very, very key everywhere in the world. You need finances to be able to access care, irrespective of your the family's understanding of the concept of mental illness. Generally, whether you are accessing care with the faith healers, spiritual healers, or even it's actually required a lot of resources. Now, it's good we're having this problem so that we open up so that people don't just narrow support to only financial. While financial is actually very good and key, but in my own understanding and experience, I think there are other aspects of the support that we tend to water down, which are very, very key. In fact, sometimes, and this to people who have mental health challenge, more important. Now, one of it is emotional support, very, very key form of support. And one of the things about our African setting, whatever culture you go in, is this understanding, as was mentioned earlier, the belief or the assumption that mental health problems are actually a communal problem. And that's why you see whenever somebody have a maybe had experience maybe a significant life event, a loss, or any other condition that could make them predispose them to having mental illness, family must really tend to gather around. So we understand or tend to perceive other people's problems are our problems. So by being showing up around and actually providing soothing word and words of encouragement, like, okay, don't worry, yeah, you get through this thing. It's something you tend to see irrespective of ethnicity or national borders. I think it's just inherent in the way we still keep kinship and family values. So emotional support is as important as financial support, and that's quite very common in clinical practice. Again, one of the things you tend to see that is when people have lost loved ones, people tend to live with them, even stay in the house for long. We know that's a significant life event that could push some people to having mental health challenge. So other forms of for support could be people calling them, people maybe making phone calls to really, how are you doing, checking on them. So it's quite very common uh, in our own setting. Then the main one I find very, very important, and one of the best way we express support, which I think stand us out as Africans, or based on how we see mental, is being physically around, like being physically around a person who has mental challenge. I think it's also a bit part of the emotional support, but being physically around or providing physical support entails just beyond the maybe the expression of emotional support. I understand you, sorry, but in our setting, it required the person actually providing we could see key services like what we call the activities of daily living. There are a lot of things we take for granted when we are maybe mentally or physically stable, but this tend to impact more people who, when they have significant mental challenge. Now, activities of daily living include the just waking up in the morning, freshen up, take care of the person's bath, dress up, eat, move around, to do one or two things that we take for granted. Now, people with severe mental condition tend to maybe they tend to battle or find it a challenge to do some of these things. Now, what that means is people with severe mental illness require support. And in a lot of times, we see family members being physically around. Now, whether the people have, well, irrespective of people understanding, there's usually that one family. In fact, we felt it's a moral obligation. So that's one of the things. So it's a key form of support. It's a moral obligation for family members to come around and provide support. So that's something quite unique for people in the third world countries and especially Africa, because we still tend to keep our kinship and ethnicity. People could actually go to the mass to defend their ethnic clan and something. So and that become a very key resource when it comes to providing support in mental illness. So typically when people have severe mental condition like maybe schizophrenia that has caused some level of disability, particularly level, at the personal level, you could see family members being around with them to actually support them, maybe take care of them, bath them, offer them food, and importantly, making sacrifices by going from one treatment center to the other. So you could see family members are living maybe their own employment to actually just be there with a loved ones. So when we talk about support, people just tend to look at financial, but the cost of the indirect cost that people incur is quite high, particularly when it comes to maybe this physical support. So I think that one of the things that people listening should have like a take away the physical support, which is very key, because when we talk about physical support that caregivers or family members offered, we don't realize that if Mr. A who lives with a patient maybe in a local government, maybe or in an area that is maybe 100 kilometers away from a treatment center, that person will have to make a sacrifice, don't go to work, maybe sacrifice whatever he does just to accompany. And we see that a lot in clinic. Most people who do with people with mental health challenge will actually share, because a lot of times they require a caregiver to be with them all through a facility. And sometimes it requires traveling, particularly if it is accessing non-orthodox care, moving from one village to the other. So financial is one, but I think some of the key things we see is this physical, emotional support, which is actually inherent to people in developing worlds, and especially in Africa.
Well, thank you very much. I really like the aspect of emphasizing on the aspect of communal support. You know, it's an honor to hear your perspective, and I believe that your responses offer practical wisdom and a powerful reflection, and I deeply appreciate that. Thank you so much. So before I come back to you and Dr. Mfona, I'd like to introduce our third guest. His name is Reverend Father Fidelis Bature. Reverend Father Bature is a priest with the Catholic Diocese of Meduguri, located in northeast Nigeria. He completed his education at the Institute of Psychology at the Pontificia Gregorian University in Rome. For the past 5 years, as a clinical psychologist, he has supported thousands of women, children, and vulnerable individuals who have endured various forms of trauma and religious violence. Currently, he serves as the Director of Mental Health and Psychosocial Support and Trauma Care Unit of his diocese, which provides aid to internally displaced persons residing in camps. Welcome, Father.
Hello, welcome and good evening, everybody. Sorry I joined late. I had some little challenges, but I'm here. Thank you very much, and it's nice to see you.
Thank you so much. So is it okay to just jump you into the upcoming question?
Well, that's okay with me. Thank you.
Okay. All right, Father, in your opinion and your expertise, I'd like to know, what is the role of spirituality in mental health and healing in African traditions, and how does it influence treatment practices?
Yeah, thank you very much, and good evening, everyone. When you mentioned the word spirituality, I think in African context, spirituality is quite a word that a lot of people are at home with, though it's easier to speak of spiritualities because there are There's no one African traditional religion. There are different perspectives. There could be connecting lines in the understanding of spirituality in the African context, but almost every country, or sometimes as diverse as a country like Nigeria is, but also other countries in Africa, there are certain peculiarities about their belief system. Now, spirituality is a large space that talks of the relationship between an individual and a deity, or some form of communion that the person enjoys with spiritual realities. It encompasses his belief system or her belief system, the community's cultural practices, the expression of such belief system, and what binds them together, and the supreme being or deity they worship. Which is to say, then, if we talk of spirituality, it's deeper than, let's say, religion, because you find some internal communion or connection that a person has with spiritual realities and the belief system. Talking about mental health and spirituality, broadly, we can classify that and say, in the context mostly that the mental health is taken, we can go the via positiva, that is a positive sense of understanding of mental health and spirituality, and the via negativa. In the spiritual sense, in the positive sense of mental health and spirituality, some of the religious practices or spiritualities that we have are commonly connected with the spirits. For instance, divinations, incantations, the use of spiritual powers or that connection between an individual and the nether world or the other world is understood as spirituality. And certain people sometimes live such kind of experiences that require a deeper understanding. And I remember very well when I saw the preparation for this evening's program or session, when we are talking of hermeneutics of religious experience and certain experiences that are far away from the common experience that can be interpreted in the normal parlance. So there are certain religious practices that invoke the use of spiritual realities or spiritual beings to understand what happens to an individual. Now, this is via positiva. It's a positive understanding. Let's take, for instance, the sense of prophecy. Sometimes, in order to attain some connection with the divine, some incantation and some kind of trance, people have to go into trance that will allow them to connect with the spiritual realities. Now, this is very positive because people worship in that form. It is not a common experience to all, and not even believers or people who practice such spirituality could have such access. So it requires a special power, a special kind of gift to be able to attain that. Now, we must be careful in discerning as practitioners, or even as a community, we must be careful not to always classify people who have such spiritual experiences as really having mental issues. So for a particular period of time, a community of worshippers or an individual could enter into a trance through certain processes that has an impact on the mental capacity of the person. Now, this is the via positiva. The via negativa is the understanding of mental health as a curse when we go into the concept of reward and punishment. People who sometimes have what we classify, psychotic illnesses are considered to have been either punished by some deity or a curse has been laid on them. In fact, in my language, the word for a mad person is called mndagu, meaning a person who is in the underworld or in the grave is influencing the behavior. And so when someone behaves abnormally, if people want to describe it, then they will say, maybe someone who has died is influencing such a behavior. Mndagu. So someone in the grave or someone in the underworld is controlling such an individual. And so that is the via negativa understanding of mental health and spirituality. How can African traditional system, how do we interpret such things? We must be careful that not every kind of experience will be called mental illness. And not all forms of mental illness are spiritual possessions. And I think in one of the sessions we had here. I was very happy. I attended one of the webinar, and thank you so much. What you do with this platform. Someone was speaking of trying to work closely with traditional healers. I know there's a question coming up on that. Trying to work closely with traditional healers to also help them understand. And this is what we are doing even in Maiduguri. I work in Borno State, and Yobe, I'm part of Adamawa, working with traditional practitioners to help them understand that not all forms of mental illness are spiritual possessions. And I think I once gave the experience of one young man who was said to have been possessed by an evil spirit, and they kept him in chain and kept using smoke for the young man who was suffering from schizophrenia. So when some of my staff in the community discovered that, they cleaned him up. He was locked up actually in an animal's room in a very poor condition. We had to get him out, clean him up, send him to Federal Neuropsychiatry in Maiduguri. He was diagnosed, he was placed on his medication. The young man is good, he's clean, he's helping his mother. So in the spiritual sense, or in the spiritual understanding, we need to be careful not to interpret everything as though it is a spiritual reality. And we must be careful at the same time to help people who do spiritual healing not to insist. And I don't want to even speak of only traditional healers. With due respect, I'm a priest, and I should speak of my religious brothers very well, especially those who are into healing. But there are certain excesses where people are treated as though they are spiritually possessed. Well, it's a typical case of mental illness. I think we as pastors, as religious leaders, must learn to make that distinction and help people to go to the appropriate place to receive health when it is mental illness. So maybe I stop here and allow for maybe the next question you would want to ask. Thank you.
Thank you so much. That was quite informative. My goodness. Thank you for your generously sharing your time and that of your staff and experiences with us. We really appreciate that. Thank you. I would move next to Dr. Umfon. The next question. How do traditional African view define a perceived mental health and mental illness? Are they direct terms or are these understood differently?
Yes. Okay. Traditional African worldviews, mental health, in some aspects, they view it differently. More often than not, they view it differently. And it's quite different from the Western biomedical models, like we know. So, and here is a breakdown. We have a breakdown of how they view it. We're going to segment it. The general view is that mental health is not seen as separate aspect of a person. It's not seen as a separate aspect of a person. That's a key way that the African culture looks at mental health. They don't view it as an individual thing, but it is connected with a physical health of the person, is connected with, that is not separate from a person, as it were, but is interconnected with a person's physical health, is connected with a person's spiritual balance, is connected with a person's family harmony, is connected with a person's commitment and relationship in the community, is connected with the person's ancestral favor. So it's intertwined in a whole, in many aspects. So it's not just looked at as a case, oh, this is a medical case, but it's looked at as many factors coming together to say, oh, this person is mentally healthy or the person is not mentally healthy. So for in the African culture, more often than not, a mentally healthy person is one who is in harmony with himself or herself, is in harmony with family, is in harmony with family ancestry, is in harmony with the community, is in harmony with nature. So you see, it's really complicated. Okay, it's very, very involving. And they also look at mental health in terms of moral lifestyle. If the person lives a morally sound life, that person is okay. If the person respect elders and respect traditions, that person is okay. That's how they view mental, health state. And then if you fulfill spiritual and social and cultural obligations, you're okay. You understand? Then another way they look at it is the spiritual and ancestral interpretation of mental health. So they view mental illness often as a spiritual disturbance or ancestral disfavor. So when there is a case of mental illness, it's like, oh, somebody has gone to disturb the ancestral spirits that were resting somewhere. And because of that disturbance, they are either angry and have decided to, bring disfavor on this person and all that. It's not always on the negative side. When there is that mental thing, in fact, there is a particular community that looks at it as, oh, whoever has mental illness has been favored by the gods. And if that person does not accept that responsibility, maybe the gods are calling the person, for instance, into healing, should I say ministry or healing capacity? I think that's a better word. Has called the person into healing capacity, and the person has refused. Because the person has refused, the person has to be tormented. The person has to be, the gods have to show the person that, look, I am the one calling you. Better word, that it is a spiritual calling when they see the person has become mentally ill. So the spirit that the person is not agreeing to work with has brought that distortion, and so the person is facing the consequences of disobedience to the calling of the gods. It's funny, but that's what is really, happens in some aspect of our culture. So because when it is termed as in a spiritual disturbance and ancestral disfavor, we see it, they interpret it as a curse, or that the curse has come upon this person, or the person is under witchcraft manipulations, or the person has violated, or committed a taboo, or the person has disrupted cultural norms, or the person has spiritual possession, or has a divine is undergoing a divine punishment, either for disobedience or for truncating something that was set, in according to the ancestral spirits. So now they also look at it as a community identity. The mental health is looked at as community identity, and just like Dr. Mohammed had said, that they don't view it as, oh, this is this person's problem, especially the family setting. They look at it as, oh, a member of the family is ill and we are ill, we are sick. So whatever has to be done, if it is a spiritual cleansing, everybody is ready to go through it. If the community has to be cleansed, the community has to go through it. And then the common practices, of course, like I said before, spiritual healings, rituals, herbal medication, traditional medications, emotional support and stuff like that are brought into play. Now, what are the terms? Are they terms that the African culture used to, describe mental illness? Some communities have and some don't have. But generally, should I say, there is a way it is described. Somebody will say, oh, this person has lost his or her mind. Those are terms that are used to describe, mental illness. He said, this person is no longer himself. He's no longer himself. So he has lost his mind. Or some people say, oh, this person is hearing voices. This person is communicating with the ancestors, is hearing voices with the ancestors. And that's how they term it. Or this person has gone mental. This person has, they will just give it their own phrase to describe the state, because for some people, they don't really know what it is. So they just give it a term that best suits and best describes how they see it. But on the whole, they look at it in different aspects: the spiritual and ancestral aspect, the community aspect, the individual, the family aspect. They look at it as, the physical well-being of the person, moral values of the person, traditional respect for cultures and all that. So that's how the African world views and defines the mental health illness. Thank you so much.
Thank you, Dr. Mfon. Wow, we have a lot of work to do, a lot of enlightenment. Thank you for enlightening us on the cultural interconnection or interconnectivity in terms of African worldview on mental health illness, whether it is defined or perceived. Thank you so much. I think I would believe the audience. Yes, there's a lot of acknowledgement of what we're hearing, and so greatly appreciate your kind support. I would move to Dr. Gidado right now on what are some common stigma related to mental health in African community, and how do this impact help-seeking behaviors?
Oh, great. So it's unfortunately stigma is quite common in our societies in Africa. Well, just to be clear, stigma is not just common in Africa; it's common all over the world, and especially people with mental health condition pay the higher price compared to physical illnesses. Now, to be able to actually, oh, well, it's also good to really start the discussion by explain what is stigma. It's a word that we commonly push around, but maybe most people don't really understand the component or the how broad what it is. So basically, a very simple way of understanding stigma entails it's actually a negative belief that's commonly held by maybe um, a very good number of people of the community. So this belief is also associated with emotional and behavioral responses. So it's not just having a negative belief, and the negative belief tends to be either against a certain person or uh, people in the community. So it's a belief mainly negative with associated behavioral and emotional maybe responses. Now, to very understand this thing, and one of the things that people with mental experience. So basically, there are two type of stigma. Commonly, you could describe stigma in various type, but a very common one is public stigma and self stigma. Now, a lot of times when we discuss stigma, we only tend to narrow it down to public stigma. Well, that's not been entirely fair to a lot of people. And for the purpose of discussion and people listening, self stigma is quite a huge problem and has a very significant impact, particularly in people with mental illness. But again, why do people even stigmatize people with mental condition? We've had a very expensive, maybe a very extensive. Uh, Maybe presentation or response from the Holy Father, Dr. Basi has actually mentioned some of these things. For example, it's all boiled down on our belief. For example, the belief of witchcraft or people who have mental illness is being possessed. I will fear that it was mentioned that in some part of the community or African believe that when people have mental illness, actually maybe a rat from their ancestors. So you could imagine a lot of times nobody actually want to be associated with the ancestors unless they're giving them money or they leave inheritance for them. So that negative or belief of the causes, mental illness is caused by maybe witchcraft, moral failure. Because even though, let me also use this opportunity to mention that mental illness is not the opposite of mental health. Of course, this is discussion about mental health, but we are a bit narrowing down to mental illness because that's how it's been viewed in the African worldview of it. Is like, okay, if you don't have mental, if you it's either mental health or mental illness, and because of that, it's good to understand that they are not, at least from the orthodox side, they are not less than over maybe possible maybe 500 or 1,000 possible different diagnoses of mental health. For example, the ICD, which is like a compendium of what clinicians use to make diagnosis of mental health, has nothing less than maybe 500 or over 1,000 possible diagnoses. Interestingly, even in clinical practice, when you see people present, they actually tend to present in this various unit of diagnosis. Yes, the expression and presentation of the illness may not be similar to the Western world. However, you could still put people into the rubric or syndrome of illnesses. So the way you see depression, it's in the books, it's actually what you see people tend to. By the time you make the diagnosis and treatment, that's what happened. So whether it's psychosis, anxiety, so it's following that pattern. But when we said, because I'm emphasizing, because the reason why we have stigma is because of one of the reasons is because of belief as what is the cause. Because if it's witchcraft, and a common thing is people with severe depression tend to have guilt and confess of crime they don't do. And the young man who died in the village, a stone throw away, died because I killed him. I possess his whatever soul or something, and before you know, there may be a mob action. So I'm experiencing because our beliefs of the causes actually influence the common stigma we see. Then another thing that also promotes stigma, unfortunately, is as we mentioned earlier, the communal belief about mental is that mental illness is seen as more of an communal identity rather than an individual focus. So if family members feel a member of a family is having mental challenge, so there's this perception of shame, social isolation, so fear, because people are concerned about the retribution from the family, because again it's going back to what we think is a cause of this thing. So one of our ancestors or somebody had a miracle that's why he's here. So these are actually some of the key things that are actually foiling or normalizing stigma in the community. Of course, with more education, this interaction is one of it. It's tend to enlighten people. And public stigma. So there are about three key components that actually define stigma, and I will quickly go through them so that people listening have a view, because it is not just about the belief. So, for example, one of the key things or attributes or component that come together to actually produce or identify as a stigma is first, there's what we call stereotype. Now, stereotype is actually the negative belief. So you think somebody is a witch, so or you think mental illness caused by A, B, C. So that belief that is common, that's what is called the stereotype. And how is that? People, by the time you have a belief, so you're likely now to begin to now go to the next one, which is actually the prejudice. So the first component is stereotype. So you have this negative belief about mental illness. Now, in this context, mental illness. So in the public stigma, that could actually manifest as a fear. So okay, so not even fear first, well, dangerous. So we tend to generally believe that people with mental illness are dangerous. So that's a very common belief. So that's actually a stereotype, because if you believe somebody is dangerous, of course you need to take other steps to ensure you protect yourself. Now, for the people with mental illness, now self stigma in their own world, because they also tend to acknowledge or believe they are weak because of the mental illness. So after now the belief, which is stereotype, the next item is of course prejudice. Now prejudice means endorsement and then emotional responses. So we first have the belief. So mental people with mental illness are actually dangerous, or it's caused by so. So well, if I think Mr. A is dangerous, I endorse that by actually treating him in that way. And what do I do? Of course, people begin to now maybe avoid them. So you now endorse that is by, okay, let me just give this person a space because you think the person is dangerous. And then other things are you also express fear towards them, because those are emotional responses. You already accepted, so it's generally. Now for the person's self stigma will now also entails the person also now have maybe some level of low self esteem, because they also believe. Then the last component is actually discrimination. When people say discrimination, when people talk about stigma, generally they only look at the discrimination aspect of the, maybe say, if you say definition. So we do not really see the stereotype and prejudice as actually integral part, in fact, as the foundation of behavioral expression, which is a discrimination. And this tend to do a lot of undoing to people with mental health challenge. And some of the way we do these things is we tend to deny or hold on opportunities of people to mental condition. This is very clear. They are discriminated against employment. In fact, some people may not even allow people with mental challenge to marry. And you have cultures who actually ask, do you have somebody in your family has a mental illness? Or we don't even provide them help when they have maybe an acute breakdown. For example, somebody with let's say epilepsy now felt and is having maybe convulsions. People actually people run away because there's this belief that okay, if he touched you or saliva spit touch the person may actually get contaminated or even take up the illness. So these are quite very common things. So when people remember stigma, don't just think about the behavior. Think about the first. How did this start? And it started by first having the stereotype and the belief. Then after they believe, the emotional response, which is prejudice. So you tend to subtly express that without even mentioning it. Then the behavior. So, but that's public stigma. So it's almost the same thing as in the as in the self stigma. Now, one of the very concerning thing about self stigma, which can actually be more severe than even the public stigma, is because the person actually internalize and accept I am not good enough, and that is why about 90 or more percent of people who have committed suicide have mental health condition, because the person actually take up. And unfortunately, the way we actually express this stigma, because there was this famous study that was done on people with mental illness. One of the reasons why people, particularly with schizophrenia and psychotic disorder, have breakdown is what is called high expressed emotions, and these are like the typify stigma. So we tend to do some things when we have people with mental illness. Typically, of course, there are certain you said, okay, you started right, so the thing don't become bar, you don't the kulu. So, but these are words we use that actually show negative comments. So since people over time with mental health tend to internalize and accept that this is how they are, and that actually make them to downplay their potentials. We all know that mental illness are not just treatable, but people could have a near normal life with treatment depending on the type and severity. So we must acknowledge that mental illness is very common. Stigma is quite common, and we could do well by understanding and giving people with mental health an opportunity.
All right. Thank you so much. Thank you, man. That was a lot. I think we have to bring you back and just have um, um, just try and have a session on a stigma based on a different cultural perspective. So I'd like to take one more question, and I hope that Father Bature would hurry up and rush it up maybe in 2 or 3 minutes, and so that everybody can have a 30 seconds last word. Currently, Father Bature, you serve as the Director of Mental Health and Psychosocial Support and Trauma Care Center in your diocese. And what you guys do, you provide aid to internally displaced persons residing in the camp, which is IDP. I believe that there are a lot of youth within the camp, and there are challenges that also exhibits itself. So then my question to you now is, how are mental health challenges affecting the youth in Africa as well as the IDP camp? And what cultural grounded interventions are showing promises?
Thank you very much. And I want to thank the two speakers also who spoke a lot about other things. And since you say we should be just very snappy, some area I love to talk so much about, but I will make it very brief.
Okay.
Mental health challenges, it's a wide area. So permit me then, if I just have to just talk and name and list and jump. The common thing we talk about that everyone want to point finger to is the use of alcohol and substance or drug abuse, as we commonly call it in our parlance here. The abuse of substances, opioids, stimulants, psychoactive drugs. That's a whole big area of mental health challenge for the young people. And we see that in IDP camps. You can imagine some people who ran from their communities for the past 8-10 years have lived in those camps, having nothing to do, out of school and no work to do so much. What do you expect? Of course, the immediate impact you see is that more intake of substance, then crime grows like rape and all forms of violence. Okay, so that's the whole cycle itself. Absence of work, abuse of substance or drugs, as the case may be, other related crimes such as rape, violence in between people, even theft. You find that in IDP camps, but also in the community. But apart from just talking about alcohol and use of substance, young people also face anxiety. They face depression. And another big thing that is not only in IDP camps is dysmophobia, dysmorphia, which is, this whole thing about body and care and all that. And then the other aspect is eating disorders. It's becoming very common among young people now. So these are variety of, or myriads of mental health challenges: use of substance, anxiety, depression, eating disorder, and even the classic, psychotic illnesses that young people have. What are the impact? How is it affecting the young people? You discover that crime is increasing. It's a high rise of crime. Violence is also increasing. Theft is there. Young people begin to give up hope. And of course, once you talk of loss of hope, immediately what comes to your mind is the idea of suicide. And suicide is becoming a very serious thing for young people in Africa. What culturally grounded interventions could we include or that we can use to support people? Africa has a very responsible system that maybe lately we are avoiding. That sense of psychosocial support. Psychosocial support is where a peer group is identified and they identify for their talents and what they can contribute to the community. And I want to speak positively and very well about the model of the civilian JTF in Maiduguri, because that's one of those things that even at the international level, people want to study. That young people put themselves together, call themselves Joint Task Force. That's why they are called civilian JTF, Civilian Joint Task Force. And they work with the military forces to secure their community. That has helped to cut down crime, and they can talk to one another. It has helped to cut down crime. It has helped to give them a sense of purpose and meaning, and they become actively involved in supporting the community. And even cutting down on crime and abuses like rape and use of substance, they also help in settling communal disputes. So these are culturally grounded practices or a model that can be adopted to help young people face frustration and challenge. So psychosocial support, peer support. Religious social support, that sense of responsibility. You find in African context that young people have a role to play in this religion or even in places of worship. Giving them responsibility to carry out helps to cut down the level of frustration that leads them into use of substance, and that can help young people, their culturally grounded practices. Also, that sense of initiation. I know gradually it is dying out because people don't want to go back to the old model of having rise of initiation into adulthood. But it was a platform that helped young people to understand, oh, well, I have arrived at something, and I can be beneficial to my community. So yes, young people can face variety of mental health challenges. We have certain culturally grounded practices such as peer support system, sense of responsibility for the young people, and giving them the sense of hope and meaning and purpose, because religious leaders and cultural practices have a way of bringing out values. That's the point I would have loved to speak so much about, but I know time, and you are looking at me and nodding. There, use of values, African cultural values, to help young people realize their role in the community, that they are not just people who are there to be used as distinct agents of political thuggery and all that, but they have a space in the society and they can contribute meaningfully. And above all, I want to say this last one and I drop it. Young people are good at influencing themselves. Oftentimes, when we talk of peer influence, we go to peer pressure and how they influence themselves negatively. Young people can also influence themselves positively. And I think that is what we can harness. And we have used that in camps where we train them as peer counselors. Again, that's a big area I would have spoken long. Peer counselors, meaning they are the people who can go to talk to themselves and say, hey, stop this, and they can help to stop that. And we found that very effective in our model of intervention of MHPSS in Borno. Thank you, and over from me.
Thank you so much. Thank you. My goodness, I'm taking a lot of note on our way forward and how to collaborate and get things done. And that's what this is always all about, getting ideas and just have in mind that I would bring everyone back individually for us on a show like this, for us to now, you have that hour to really talk about, those things that you do and what you're passionate about. So, and that's been all for today. However, I would want our guests, they have 30 seconds. So tech team, reminder, they have 30 seconds to just give a word, whatever it is, and then we can say a farewell after that. So Dr. Fon, 30 seconds. Let's do
30
white time.
seconds.
Yeah,
Wow.
not African time. Not African time.
Right, no problem. All
Mhm.
right, we talked about the views of the African culture on mental health, how it's viewed. These indigenous views have helped to shape the belief system of people. However, it also provides an emotional framework and coping strategy. Yes, like we talked about the communal support, the psychological support, emotional support. But we found out that sometimes this conflicts with the medical, the clinical needs of the people. They infringe on or prevent people because they look at the source of mental health as being spiritual only. So my conclusion or my what I want people to take out from this teaching or from this session is that we can integrate traditional and modern mental health practices in a respectful, culturally sensitive, and a manner, and to improve the mental awareness, where they should strike a balance. It is not every mental case, illness case, that is spiritual. And like I think it was father that talked about it, Dr. Bature, that talked about it, that they should work hand in hand. There should be enlightenment even for these traditional leaders, to come to terms with the fact that it's not every mental illness that is of spiritual origin, although the cultural values and norms of the people should be preserved, and that communal support system should also be encouraged. Thank you so much.
Thank
Thank
you,
you.
thank you, thank you. Okay, over to you, Dr. Gidado. Let's see if you're going to beat the 30 seconds.
Yeah, that was, I got it. I will do that. So the thing is the mind. So as the team, the talking mind. So we must see the drum actually is not just a musical instrument in Africa. It's actually a means of communication. Different Dumb Britain actually communicate different things. So that's what the mind is. So we should learn to listen to the mind when it speaks. It's also like a talking drum. So sometimes the silence may actually be a way of communication. So we should listen to the silence and distress of the mind, and that's expressed in symptoms of mental health condition. Thank you.
Okay, thank you so much. He tried. All right, okay, now over to you, Father Bature. Let's see if we can hit 30 seconds.
Okay, mental health is real, and we have very rich cultural practices that can work with the common or the scientific methods that we have. But we need a lot of sensitization to help people to understand that they need to seek help where they have such mental illnesses. And of course, no other better group can be better to do that than practitioners working closely with young people. And so we have rich practices, and I think we can make our community better if we work together. Sensitization is the key, and we can do it. Thank you.
Thank you so much. Look at him. He tried to hit it in 30 seconds. Well, that is good. We strongly, we appreciate you. And well, audience, you've heard it. Today's topic was the talking drum of the mind, mental health in the African worldview. So we just want to thank our guests for your valuable insights and to our audience for your engagement. Let us continue advocating for mental health solutions that honor and integrate African cultural wisdom and modern knowledge. So I thank you everyone for your time And I look forward to having this conversation again next month. And, we keep bringing you powerful and interesting guests. So thank you, and have a pleasant weekend. See you next time.